If you're joining my life, you're welcome. So I'm talking about vasectomy. If I've, in case of if you have heard of vasectomy before, it's a form of birth control for men. Vasectomy is a form of birth control for men, although it's not something that the society talk about much when it comes to birth control. They focus more on women when it comes to birth control, but there are also birth control for men, and people don't really talk much of it. There's no much awareness on this birth control for men. So some women, they notice that when once they start taking all these birth control pills, it disorganizes their hormone. Some of them will not see their period for months. Some of them will not see their period for months, and once the period starts coming, they will bleed and bleed. Some can bleed for even a full month. So if maybe you are couples and you are done having children, you don't want to have kids again, you're done having kids, or maybe you're not interested in having kids, or maybe pregnancy can be at risk to your partner, your wife, or anybody, there's something called vasectomy. Now vasectomy is a procedure where they just a procedure, a surgical procedure where they cut the disconnect or cut vas difference. Now I need to explain how this thing works. Firstly, the sperm is produced in the testes. After production, it is transported to the epidermis. Now in the epidermis is where sperm matures and is stored. Then during sexual intercourse, during sexual arousal, the epidermis contracts, and this sperm is transported into the vas deferens, which is the tube that connects the vas deferens to the ejaculating duct. From the ejaculating duct, then to the urethra, where it is ejaculated into the woman's vagina, the female's vagina. Now, in vasectomy, this tube that connects the epidermis, that transport the sperm, is cut off through surgery. The surgical procedure, they cut it off, the two tubes, because it's just like fallopian tube. Remember, fallopian tube is what connects the egg to the womb, which is the uterus. Without the fallopian tube, even if every month you ovulate, there will be no conception because there's no fertilization. Understand? So in men, vasectomy, that vas difference is just like the fallopian tube in women that connects the sperm to where it is ejaculated, where it is transported out of the body. Let me just put it that local way. So in vasectomy, that particular tube is cut and tied so that sperm cannot be transported. So it might be asking, can someone that has undergo vasectomy as a man, can he still ejaculate semen? The answer is yes. You can actually ejaculate semen, but there will be no sperm inside. And vasectomy does not stop a man from producing sperm. Remember, the sperm is produced in the testes and is transported, after production, is transported to the epidermis, where it is stored, where it's matured and stored. But when there is a vasectomy, of course, there will be production of sperm, just that the tube that transports it to the ejaculating duct, where it is ejaculated out through the urethra, it is cut off. You understand? It is cut off. So this is one of the safest method for birth control. For couples that don't want to give birth again, or for couples that has so many children, or for couples that have decided not to give birth again, this is one of the safest method of birth control, and our society don't talk much about it. They focus more on women. When it comes to birth control, is more on women, and this particular drugs they give them, implants, all those stuff, plays so many disadvantageous role in our body. So women can bleed for months, So if maybe a couple and maybe don't want to have kids again, you are done having kids, you have children, or if pregnancy can play a risk role in the life of the wife, another option you can go for is vasectomy. You understand? Another option you can go for is vasectomy. Is easy. It's not. It's something that that surgery can take like 15 to 30 minutes. It's not something that they will admit you. No, you don't need to be admitted. It just they will give you local anesthesia. Local anesthesia is not general anesthesia. Local anesthesia is where they will inject you a drugs that will just numb that particular area that that procedure will be taking place. Maybe they will numb the skin, the scrotum, maybe the vas deferens, that area. So you'll be awake when the surgery is going on. It's not something that will take time, you understand? It's not a surgery that will take time, and it's not painful surgery. It's not like fibroid surgery, or those surgery that once you go through it, it can take days, weeks, to recover, to get yourself. Vasectomy surgery is an easy surgery, 15 to 10 minutes, just numbing the particular spot, local anesthesia. Why if for general anesthesia is when